You know life has its ups and downs. Turn your pretty face to an ugly frown. Seems that when I fix one thing.
Hello, welcome to The Awakening. I'm your host, Angela Brown. Today's topic for discussion, we're going to be talking about physical therapy. And I have a young gentleman here with me today. His name is Carlos Martinez, and he is the physical therapist. And we will be talking about your body and your bones. Welcome.
Thank you. How you doing?
I'm doing well, thank you. After
Great.
all the time I had to get ready.
All right.
Tell me, why did you get into being a physical therapist?
Well, I got into physical therapy because I joined the Air Force. I had no idea what physical therapy was.
You didn't?
Oh, I had no idea, none at all. I just knew I was going to go into the Air Force. I was a pre-law major before I decided to go into the Air Force. And they gave me a job. I went in what they call open general, and they gave me physical therapy as a job.
What's open general?
Open general would be where they can give you any job. So, you know, I remember sitting down and they said, okay, you're going to be a physical therapy specialist. So I reviewed the criteria. I was excited about it. I went to my training. They sent me to Shepherd Air Force Base in Texas. And that's where I started my physical therapy training over there.
How long did you train there?
I was in training in Shepherd Air Force Base probably 4 months, 5 months, something like that.
Smart learner then, quick.
Yeah, that's the way the military does it. They get you going and they move you along. So then from there I went to my first duty station overseas.
Whereabouts?
I was in the Clark Air Base in the Philippines.
Okay.
And I worked over there doing physical therapy. Then I came to Andrews Air Force Base in
that too.
I came to Andrews in '89 and been in the area ever since.
Okay, I'm going to pick your brain. You married?
Yes, I'm married.
You seem happily married. You got a beautiful smile on your face.
Yes.
Children?
Yes, we have
Cool.
4 children.
Okay. When did you start working for your company?
Well, I opened up my practice in 2003.
So this is your practice?
Yes. Yes.
Cool. Okay.
Yes, I opened up my first office in Hyattsville. Then I decided to expand.
I lived in Hyattsville a long time ago.
Oh, really? Okay. Yeah, and we decided to expand, and we expanded out to the Laurel area and to the Bowie area. So it's been a good growth process.
Let's tell our viewers how you got here today.
Well,
Because they always want to know.
right.
Do you pick them up off the street, Angie? No, I don't.
Right. Well, my marketing guru, Taylor Farrell Warren, he contacted you.
Yes, he did. He sent me an email.
Right, sent you an email and wanted to see if there was somewhere or another we can get on the show to talk about physical therapy. And the way it happened, he got with you. You guys ended up talking, and I'm sitting here now.
Well, I'm glad you're sitting here now. What is the most, well, let's talk physical therapy. What would you do if someone came in with a broken leg after they broke their leg?
Well, you know, we have to make sure that the leg is healed, actually, right? And we would first, any patient that comes through anything, let's say a broken leg or anything, they would come through, we have to do an evaluation to see what's going on with them first. So again, if it's something is broken, we're not going to do therapy on it right away. It's going to be healed, right? So once we do an evaluation, we'll look to see if there's any swelling in certain areas. We're going to look to see if there's a loss of strength, pain, redness. We're going to look for different areas. So once we do a full evaluation of you neurologically, your strength and everything else, we'll come up with a treatment plan for you.
Okay.
And that treatment plan may include exercise and range of motion exercise, a home exercise program.
So basically then, if someone falls down and gets hurt, of course they go to the hospital.
Right.
And then after they leave the hospital, I guess you're recommended to them.
Right.
And then they go to you, for you the man to put them back together 100%.
Right, we're the one to put them together 100%.
That's true.
That's the goal. You know, normally they'll go, they may get released from the hospital. Sometimes they'll go to see their primary care physician. Then their primary care physician will say, okay, you have this problem going on in your leg or your knee or your back hurts. So let's go ahead and have you go see a physical therapist.
Do you recommend the doctors that they come from seeing, do they recommend you? Do they know you enough?
Oh yeah, we have a lot of referral sources in the
Do
area.
you really?
A lot of physicians in the area use us. We have different physicians that use us exclusively.
Good.
Not only that, but we also work in the workers' comp arena. And we have a lot of nurse case managers and insurance carriers that will use our practice.
Okay, one question for you. What with people, I guess with over 65 Medicaid, do you work with people on Medicaid as well?
Well, as far as being over 65, that's Medicare.
Okay.
Right? And yes, so
yeah, it's right now, you told me.
yes, right? So,
okay.
That's Medicare. And yes, we are providers for Medicare, and Medicare has its own criteria, so we need to make sure that we're following certain criteria for Medicare. The thing that's interesting, though, is that the insurance companies, all the other insurance companies, the Blue Crosses, Blue Shields, and everybody else, they follow, whenever Medicare makes a change, they usually go with the Medicare changes.
Well, that's good to know.
So as long as we follow Medicare rules, we'll be good with all the other insurance companies.
Because I met a lady in Walmart the other day, because I knew you were coming on today, and she took a fall and she broke her knee below the knee and in the joint.
Okay.
Some doctor did the surgery and he told her she would need no follow-up. Now she's on a crutch.
Right.
She wears crutches and she's got her walker, because I know what walkers feel like too. I had one for a while.
Right.
So I should recommend her to you.
I would believe so. Somebody like that after surgery. Post-surgical rehab, we do a lot in the practice. And all physical therapists are after that. They all understand how to work with post-surgical rehabilitation. It's very important.
But you have to, I was a maniac being, laying still for the broken femur. I just couldn't understand that.
Right.
But there are a lot of people who say after they're healed, they feel worse than when they did before they got broken.
Well, you're saying their legs feel worse.
Their legs, their knees, their hips, or maybe even their arms.
Right. That's, if as long as you're doing the appropriate rehabilitation, you should actually feel better.
I would think so,
and if not even better than you did before the injury occurred.
Well, the people may not like me, but I believe you should not have a whole lot of weight on your body.
Oh.
If you're going to heal.
Right. Well, the weight will add a lot of stresses to the body. So a lot of times we'll get patients to the clinic that have a lot of knee pain, and they may be, severely overweight. So one of the things that they may want to do is consider lowering their weight and, getting on a good diet and exercise routine to help to prevent problems in the future.
Yeah. Because I know another gentleman, in fact, he used to work in this building, he had a knee replacement. 2 days later, he's up walking down the hall.
Well, that's the way it should be.
You see what I'm saying? It's just amazing.
Yeah, that's the way it should be. Normally, if a patient went in and they needed a knee replacement, a lot of times what will happen is they'll be in a lot of agonizing pain one day, and then the day after surgery, they don't have any pain anymore. So, and then that, of course, has to be followed up with appropriate post-surgical rehabilitation.
Well, I'm a health nut about exercising. I think if it hurts, if you exercise, it may make it feel better. And is that wrong?
No, that's not wrong. I agree with you on that.
You agree with me? Oh, thank you.
Yes.
I went over to Home Depot a few days ago, and there was a wonderful lady at the door. She's a welcomer. And the first thing she did was walk up and give me a hug. She says, "Girl, you knock them dead on that TV set." So I laughed at her. But she says, "I have nothing here and nothing here," in her knees. So I guess she means the bone is gone. But all she has is just the flesh, okay? And she says, "I'm going to have to get this fixed." And I said, "I think you should get it fixed." She said, "Do you know of anybody?" So she'll know you. I'm going to tell her when I come home.
Well, that'll be nice.
She's such a sweet lady.
Right. Well, I'll be looking forward to seeing it.
And she gets around okay, but she knows she's going to have to drop some of that weight.
Right.
Hey, tell me a few other things that you do.
Well, we work with patients with lower back pain, spinal pain. We'll work with patients that have issues with their knee. They may have sprained their knee.
Why
they may
it's
have had
always
surgery
the
to the knee. Well, it's a mobile joint. It's not the most stable joint. It's a mobile joint, though. So it takes a lot of stresses on it. So when people are playing sports, let's say, they may twist their knee, and there's a lot of ligaments in there, and it's really easy to injure the knee.
Okay.
But I would say most physical therapists, the number one thing that we treat is back pain.
Back pain.
Back pain. That's the number one thing I would say that we treat. A lot of people have issues with their back. A lot of it has to do with repetitive stress, where they're using bad body mechanics and bad posture. They're bending over versus squatting, and squatting using their legs. They're lifting using their back muscles versus using their leg muscles. They sit down with really bad posture and positioning. Their workstation may not be set properly for them. So a lot of that puts a lot of stresses on the back and all the ligaments of the back. So that's why they start feeling a lot of pain later on in the future.
Well, my husband retired a couple of years ago, and he's gained like 60 pounds.
Really?
Yes. So his back is his number one problem.
Right.
But he doesn't go in the family room to sit in his lounger. He flops in it.
Right.
Like a fish.
All right.
He flops in the chair, and I told him, "David, go back out and run like you used to." It's just going to make my back hurt
Well,
more.
it's probably going to be difficult for him to run if he gains 60 pounds, but he probably have to start off with walking and things, you know, start off with walking for a long period of time, and then once he starts losing a little bit, then he can go and start running.
But you know what people do not realize, and I go to a gym, so I know what I'm saying. They gain a little bit of weight, and I'm happy. I'm happy. I feel good. But then the back starts. Then the knees start.
Right.
So then they come to me for another remedy. Go on a diet. Go on a diet. No, no, no. I'm not going to deprive myself of anything. I said, then shut your damn mouth.
Right. Well,
I'm not the doctor. You're the doctor, but I don't think you tell me my own damn business. But the thing is, don't ask me something if you think you already know it.
right. Well, you know, a lot of times people know the answer to the questions. They just want to kind of hear what somebody's opinion is.
They just don't want to hear anybody.
Right.
How do we go about getting an appointment with you as a physical therapist?
You know, what you normally do is, in the state of Maryland, a physician is not required to see a prescription, a referral is not required to see a physical therapist. The only caveat to that is the insurance companies a lot of times may not pay.
United Healthcare.
They definitely will not pay unless you have, there may be a product that they have, but United Healthcare is very difficult and stringent. But most insurance carriers require you to have a referral to see the physical therapist because we are specialists. So once you get your prescription or referral from the physician, all you would do is call the office and you'd let the receptionist know, I would like to see the physical therapist. I have back pain, my knee hurts, my shoulder hurts. And they'd do an intake. They'd get the information, what part of the body is the area of dysfunction, what's your insurance. Let's get the numbers for the insurance card. They'll try to verify benefits before you come in. That way, when you do come in, there are no issues.
So it's all cleared away for them, so they don't have anything to be worried about.
Right. They try to find out what your copay is, and that way, by the time you come in for your first appointment, you already know. Your copay is going to be $20, and we verified the insurance for you, and they're going to pay. This much money, and it shouldn't be an
So
issue.
when you contact the insurance companies for them, or do the people do it?
No, the staff of the physical therapy office will contact the insurance company.
That works for you?
Yes.
And what she does or he does is they iron out all the rinks, I guess you would call stumbles, and they have everything straight, so you just go right together.
Exactly.
So
they iron everything out. That way, when the patient comes in, they'll know exactly what their copayment is.
Yes.
They may not have a $20 copay. They may be required to only pay 10% of the bill, and that 10% is only on what the insurance company allows, not necessarily on what we charge. But that way the patient knows exactly what they're going to be responsible for there, so that there's no issues or surprises later on.
Okay, so when somebody does come in to see, I know the first thing they're going to say, how long do I have to come here? But you probably don't know that until you get started.
Well, you never know how long it's going to take for somebody to get better. Everybody's different. So,
yes, I'm glad to hear you say that.
You see a patient, not every single patient is going to be seen the same amount of time and for the duration of therapy. Some patient may come in 4 weeks. Some patient may have to come 6 weeks. Patient may have to come 8 weeks. If you have somebody who had a rotator cuff repair.
Now, what is a rotator?
Well, a rotator cuff is in the shoulder. Those are muscles in the shoulder. So if there's a tear there and the surgeon has to do surgery there, there's a certain
Is it
protocol.
like a bone?
No, it's actually a muscle. There's a series of muscles in the shoulder. So you may tear an area in there and it needs to be repaired. Okay, so if that has to get repaired, you can't just lift up the arm because you may tear the repair that the surgeon did, right? So it's going to take a lot longer.
So the surgeon goes in and does the repair work.
Right.
And then you have to, I guess you got to lay mobile till you heal.
Well, you're not laying mobile. You're going to go to therapy and you're going to go ahead and start different exercises. But
before you raise your arm up is what we're going to say.
Right. You won't be able to raise your arm. You're not going to be allowed to raise your arm, initially. The therapist will raise it for you. Okay, and give you different exercises to get the mobility back. Okay, so there's a certain protocol that you follow with something like that. So the point that I'm making on that is that your therapy there may be 3 months versus 4 weeks. Okay, so everybody's a little.
So the rotator cuff is hard to heal.
Well, it takes a long time.
Because I've met these really heavy guys in the gym. When I say heavy, I mean muscles. They say, "Oh my God, I just got out of surgery," and they're back there doing the same thing.